Thank you, Chairman. And Dr. Murthy, appreciate your being here and the work you've done on this topic of mental health and behavioral health more broadly for our kids. I looked at your recommendations for communities. One was that responding to mental health crises for young people should involve implementing evidence-based programs at the community level. And you cite what's called the Drug-Free Communities Act as an example of that. I'm happy to see that because I do believe that that's part of the answer here, is to not just break down social isolation, but also deal with the drug issue and its interaction with mental health. And I'm the author of that legislation years ago, but also started my own coalition back home that's still very active and I'm involved with. Can you elaborate on how drug use prevention intersects with mental health, and in particular talk about how that investment in prevention might keep people from using or abusing drugs starting at a young age?
Well, Senator, first, thank you for your leadership on this issue. I know you've been a champion, in addressing the addiction crisis in America, and we need that kind of leadership, especially because during this pandemic, we have seen overdose deaths increase to their highest levels. I'm also glad that you raised a point about prevention. In 2016, when I published the Surgeon General's report on alcohol, drugs, and health, I had devoted an entire chapter to prevention programs, most of which were school or community-based. And the powerful thing about those programs, Senator, was that they not only helped to reduce the likelihood that children would develop a substance use disorder down the line, but they also improved mental health outcomes. They improved graduation rates. They reduced teen pregnancies. They had a multiple benefit to the kids who participated in them. The other important point is that these were cost-effective programs, Senator. They saved somewhere between $2 to $11 for every $1 that was invested in them. I think we need more of these programs, not less. I think we need to provide not only more funding, but more technical assistance to schools and communities to implement these programs. I think prevention is always better than cure, and we have a lot more prevention that we can do.
Well, thank you for your work on that, and I look forward to continuing to work with you on the prevention side. You're absolutely right in terms of the efficiency of it and the cost. It's absolutely the best way to deal with the issue. We also do a lot of work, as you know, on the treatment and longer-term recovery issues, which are necessary. But prevention, I think, remains the most effective and has the most potential. On social isolation, you talked earlier about in-person learning. I'm very big on getting our kids back to school because of the data that I've seen about what that does to a child not to have that interaction with their classmates and with their teachers. One of the things we've heard in Ohio is that people want to get their kids back to school, and schools are for the most part in Ohio, responding to that. 87% of Ohio schools were open for 5-day in-person learning as of May 2021. Unfortunately, during Omicron, that number decreased. But they've talked about testing. They have said that there is inadequate testing as a contributing factor that prevents them from holding in-person learning. CDC has put forward this test-to-stay strategy, which uses contact tracing and serial testing to allow kids to stay in school. Can you talk a little about that? With about 55 million kids enrolled in school around the country, that's a lot of tests, but I think it's absolutely essential we get them back to school. And can you speak to the effectiveness of this test-to-stay strategy and the scale of testing resources that would be needed to successfully implement that nationwide?
Well, thanks, Senator. I couldn't agree with you more that getting our kids back to school is essential. My children were not in school in 2020 during the pandemic. They, in the fall of 2021, were able to go back to school. It has made a huge difference for them and also for me and my wife as parents. I think in order to keep our kids in school, I appreciate you pointing out the test-to-stay program. There are several things that can actually help our kids stay in school. One is basic prevention measures can be useful to reduce the overall likelihood of infection. Second, when kids are vaccinated, per the CDC's quarantine rules, they also do not need to leave school if they are exposed. They can mask and then they can be tested. But third, even if children are not vaccinated, the test-to-stay program is a series of regular tests that allow them to stay. What the administration has done, recognizing exactly what you said, that more tests are needed to implement that program for some schools, is they have doubled, in fact, the number of tests that they have made available to send to schools. And we have also, more broadly for the country, increased the overall number of rapid tests that are available, with the president announcing about a month ago 1 billion tests that would be available to deliver directly to homes, as well as additional tests that we were commissioning to be produced for the broader community. So if there are schools or communities that are struggling, need access to test center, I'd be happy to follow up with you afterward and find out how to connect them to the right resources in the federal government so they can get the tests that they need.
Yeah, we'd love to follow up with you on that as it relates to Ohio. And again, thanks for your service.
Thank you, sir.